Good morning, everybody. From DBpsychology Services, known on media as DBpsychology. This morning, I'm going to talk about this week's blog post, which is all about panic disorder. Panic disorder is basically a disorder which happens when somebody gets a panic attack on a reoccurring basis. So, panic is a false alarm our body sends out during the as a result of a natural thing we have in our body known with the fight, flight or freeze response. So when we have this fight, flight or freeze response, our natural systems kick in, but in some people this causes, in fact, it can cause a false alarm. It can be kicked off by something very simple. Now, it can also be kicked off because you meet something that you have a fear of, like a phobia. I think I've spoken about phobias before. So, if you're afraid of a dog and you met a dog, you might have a panic attack as a result. It's something might kick off, but generally it's because the panic attack is kicked off because it's a faulty mechanism to do with fight, flight or freeze response. It's a perfectly normal thing that people have every day. Now, in saying that, panic attacks are very uncommon, which might surprise some people. About 1 in 10 people will get it in a year. And in fact, most people only get one panic attack in their lifetime, if at all, if you ever get a panic attack. In saying that, panic disorder then is the reoccurrence on a frequent basis of, panic attacks, on multiple panic attacks during the year and during your lifetime. And some people, and it's a very small percentage, about 3% of people that have suffered panic attacks go on to develop panic disorder. Now, panic disorder is a form of anxiety disorder, as are panic attacks. They are also, there's no evidence to suggest that the panic attack or the panic disorder will cause damage to the brain or the body. There's no medical evidence of that at all, but they're very, very distressing. And they all occur you can get developed as a result of having other disorders. Anxiety, including anxiety, and as I was saying, panic disorder can happen as a result of of you having other disorders like anxiety disorder or social anxiety disorder, depression, things like that. Anything like that can other develop conditions. So, in saying that, treatment for panic disorder is usually CBT. Your GP will be able to take on board whether you have any other conditions, and your treatment will be with a psychologist who will tailor the program to suit you. And as I said, if you have developed depression or any other conditions, they will tailor the treatment to you. Usually it's cognitive behavioral therapy is used. The GP may prescribe some medication for the anxiety, or if you have depression, it'll be for the depression. Now, in saying that, a huge help is, of course, self-help. Lifestyle changes are very, very important at this time. Making your self-care a priority to aid your recovery is hugely important at this time. So in saying that, what can you do? Lifestyle changes would be the usual suspects, cut out alcohol for a time being, or substantially reduce it. If you feel you have an addiction to alcohol, of course you're going to have to get that treated. Cutting back on the cigarettes, cutting back, increasing your exercise, even 10 minutes a day, walking to start with. You would also need to be eating on a regular basis. Sometimes with anxiety, we don't want to eat. Same with depression. Sometimes we go one way or the other. So sometimes we don't want to eat. So even small, tiny meals, 5 to 6 small meals a day, can help to get the nutrients your body needs. It's so important. Getting out, as I said, the exercise is very important, not just to raise the levels of the happy hormones in your brain, but also to get you out, particularly coming into the winter time now. You're looking to get out and get the vitamin D and that into your bloodstream. So lunchtime is a very good time to take. Even a short 10 to 20 minute walk would be great. These are small changes that you can actually make yourself. Other small changes you can make by yourself, or if you need help, would be sleep. Regular sleep is hugely important. Reducing your stress levels, vital at this time. Absolutely vital. So I have written a number of blogs on reducing your stress. I've written blogs on aiding your sleep. All of these are very, very important. Meditation is a super way to reduce your stress levels, improve your sleep, and help reduce that anxiety. Remember, with panic disorder, you have an anxiety. It is an anxiety disorder. So panic attacks result of having high levels of stress and anxiety at times, not just phobias. So having that, getting that stress level down, using meditation, getting a good night's sleep, eating the right foods are all part of your basic self-care. Setting healthy boundaries with people, all part of basic self-care. Setting healthy boundaries for yourself and with yourself, and having healthy boundaries with other people, and not just personal relationships, but with friends, and with work colleagues. A lot of people may develop even panic attacks. Have a panic attack as a result of too much work stress. So you need to examine your lifestyle. You really do need to examine your lifestyle and what's going on in every aspect of your life, whether it's at home or at work or whatever it is you're doing. So have a look at that. The other thing would be to become an expert on this disorder. If this is what you have and this is what you've been diagnosed with, if you have been diagnosed with multiple conditions like depression, anxiety, and say panic disorder, or whatever it is, then become the expert on those conditions yourself. Read up as much as you can from reliable resources. Read up as much as you can, become the expert, and get to know how you can help yourself. Helping yourself it goes a long way in the battle to recovery, and asking for that help as well. So the first protocol, always GP, and then asking for a referral, or even referring yourself to a psychologist and asking for help from them. They have loads of resources in their toolboxes. I should say we have, because I'm a psychologist. So joining a support group, again, if you can find a support group locally, face-to-face groups that you can meet up with, it's wonderful. We are very much social creatures. We need that contact, even with all the social media that's out there. And, there are online groups as well, which are absolutely fantastic. But we do need that one-to-one. So, again, joining the support group, asking friends and family for help. Now, again, eliminate all negative vampires. This is your recovery. You have to prioritize yourself. So no negative vampires need apply here. Get that support from your family and friends. And, if the family something like panic disorder can affect the whole family. So again, I would suggest if family therapy is needed, or if it's connected in with other mental health conditions, or somebody else has a mental health condition and you develop panic disorder as a result, again, they're going to need help, individual help for their whatever it is they have, but family therapy may also be needed. So please reach out for help. It is there. It's very simply treated. it's a very curable condition, and that it's the support is there for you, and it can turn your whole life around, from feeling very isolated and not knowing where to go for help. If you just reach out even to your GP and say, I need help, this is what's been going on. So I'm going to leave it there, and thank you all for listening, and I will of course see you all again next week, and I'll say good morning.